Well, it's this time of the year again where we all know how it goes. We get a cold, we suffer for 7 to 10 days, and then if we're unlucky, it develops into a secondary infection like sinusitis, bronchitis, or even pneumonia. Now next, we're seeing our doctor and who puts us on antibiotics, but increasingly that doesn't do the trick. Now, if you're not sure what to do next, well, let's find out.
Antibiotics are no longer the universal solution for these infections. To find out why, we recently chatted to Dr. Peter Fisher, Director of Research at the Royal London Hospital for Integrated Medicine.
We have a really big global crisis of antimicrobial resistance. And note that I say antimicrobial, not antibiotic, because although antibiotics are the main drugs, there are also antiviral agents, which are important in this context because most respiratory tract infections are viral, and resistance to them is also emerging. And we have a really big problem, global problem. People are dying already, and many more are going to die from antibiotic resistance. So we need to find strategies for reducing antibiotic resistance. And the existing strategies are actually remarkably unimaginative. They're convergent. They say, we've got to do more of the same, only better. And we need to invent new antibiotics. There hasn't been a new class of antibiotics introduced in over 30 years. So what we need is alternatives, particularly for the vulnerable groups. And the vulnerable groups are the very young and the very old. The problem is you get a viral infection, particularly in children, and it can then develop into something, maybe to croup, maybe to pneumonia, something really serious. And you need to head that off at the pass. You need to stop that happening.
There's been a lot of international research on A. Vogel's Echinaforce, a 100% fresh plant extract of Echinacea. It acts against cold and flu viruses to prevent infection, but can it prevent the secondary complications which are the main drivers of antibiotic use in winter? Dr. Ross Walton, a cellular immunologist at Imperial College London, has studied this.
So the aim of these in vitro studies was really to try and understand the mechanisms by which Echinaforce is able to reduce some of the symptoms you might get when you get a common cold, and also suppress some of the downstream effects following the cold, which can leave you open to secondary bacterial infections, such as sinusitis, lower airway involvement, bronchitis, those more severe infections that you might get, which actually are the real complications following the common cold. So the studies found that Echinaforce is able to not only suppress the ability for virus to infect cells in the first place, but also the ability to suppress some of the downstream effects that the virus may have on your immune system. Importantly, the ability to suppress inflammation, which can lead patients open to secondary bacterial infections following a virus. So the two major findings were suppression of viral infection and also inhibition of the inflammatory pathway which happens following infection, which leads you open to secondary bacterial infection. So inflammation of the airways leads patients open to secondary bacterial infection through not only altering the airways so that it upregulates receptors which bacteria use to adhere to the cells to be able to get in and cause an infection, but also that inflammation reduces the integrity of the epithelium, so it breaks apart slightly, allowing bacteria to then transverse in deeper into the tissue and cause infection. And these studies add through investigating the ability of Echinaforce to have efficacy against rhinovirus, which is the major cause of the common cold, and understanding the ability of Echinaforce to prevent the major symptoms of the common cold, but also inhibit the inflammatory process which happens after the cold, which leads you open to secondary bacterial infections, which we see in the more severe type diseases. Rhinovirus is a particularly difficult virus to treat because firstly, it gets in very quickly, it replicates very quickly, at very low level, and then it gets out quite readily into the next patient, so it's hugely transmissible. But Echinaforce not only seems to reduce that replication event, but also, more importantly for rhinovirus, reduce the signaling inflammatory cascade which happens after the infection. And this is new evidence that we hadn't understood previously.
Proven by science, Echinaforce remains the most effective natural remedy that not only prevents and treats colds and flu, but also helps prevent their secondary infections.
A. Vogel's Echinaforce is the world's strongest herbal product that's clinically proven to prevent and treat colds, flu, and their complications.